happening in the doctor's office, primary care, clinic, home visit. Okay. We're going to talk about how to do a prenatal history. The nurse is really the one who does the prenatal history before the healthcare provider comes in. Identify factors to the father's health that should be recorded in the prenatal record. We've already talked about some of the physiologic changes. So again, that's kind of similar to those, so we'll revisit some of those things. But I think it's important as you have prenatal visits, we're going to see some variations or some changes, and those would be normal or expected. So I think the important thing to think about is this is an okay variation, this is a not okay variation. So remember I talked about at the pulse can go up by 10 beats per minute. So if your baseline pulse has been 80, now your patient is here today and her heart rate's 110, that's not normal. I would recognize that as being abnormal, okay? Talk about how to determine estimated due date, which we already did. We did Nagel's rule. And then talking about fundal height, quickening, and fetal heart tones. Again, those are key indicators during prenatal visits to determine when the gestational age. We'll talk about danger signs of pregnancy, and then here's another one that's difficult for students is the subsequent visit assessments. So we'll talk about what the pattern and the routine is, and the reason why we need to do that is the nurses are the ones who teach the patient about this, okay? So for example, the patient's gonna ask you, when do I need to come back for my next visit? And you need to be able to answer that question, okay? All right. So at the first prenatal visit, it's the longest prenatal visit. So the patient's at home, she has a positive pregnancy test. So she calls the OBGYN's office, and the OBGYN's office says, when was your last menstrual period? It was 5 weeks ago. The OBGYN may not see the patient for yet another month or 6 weeks. So that's a long time. So when you call, you don't always get seen right away. Or you might get seen for lab work only and an interview with you as the registered nurse. So then you as the registered nurse determine, does this patient need to be seen early or can it wait till 11 or 12 weeks, okay? In that prenatal visit, you're doing a health history. Usually the registered nurse will do things like vital signs, just a general head to toe assessment. You don't generally do a vaginal exam or a speculum exam or get any types of cultures. That would usually be done by the healthcare provider, like the midwife, nurse practitioner, or the physician. Labs and diagnostic tests. So we'll talk about key labs and diagnostic tests. There's a slew of them. And so what's really nice is most labs call it prenatal panel, but for us we need to know what those different labs are. So we're going to talk about that. We have to determine if the patient is low or high risk, and then lots of teaching. Now this initial prenatal visit should occur in the first trimester. So it should happen in the first 12 weeks. Generally in the first 12 weeks, we're going to do basic education with our patient to say no drugs, no alcohol, no cigarettes. You need to let us know, again, if you're having any problems with nausea, vomiting, cramping, or bleeding. Okay? So very simple things at the very beginning. Ideally, we want patients to take prenatal vitamins. However, sometimes the prenatal vitamin makes you throw up. And so you may not be able to take it first thing in the morning. You may have to take the vitamin in the evening because you can keep it down. So that's helpful. So we're going to work with Gravida, Para, and TPAL. You talked a little bit about this in clinical on Wednesday, but now we're going to practice it. So I have a worksheet for you. So tell me what Gravida means.
Total pregnancies, including the current one.
Including the current one, all right? So our patients are pregnant, all right? So, and you don't have to say this out loud, either yourself or your partner or friend, okay? If I've never been pregnant, I am not currently pregnant, I'm a Gravida 0, Para 0. If I'm in the prenatal office, I'm currently pregnant. If it's my first pregnancy, I'm a Gravida 1, Para 0, okay? So I'll have you pass that back. Did it work, Emily? You have to read it.
I had to redo it.
I think your back was.
All right, so P is for para.
You said your back was hurting.
So para, it means that you 28 weeks, I'm still a para 0 because the outcome of my delivery has not been determined yet. So the para doesn't kick in until you deliver the baby. So I'm a gravid 1, para 0, I come to labor and delivery, I have my baby. On postpartum, I'm a gravid 1, para 1. Simple, easy. All right, so now let's take a look at TPAL. On my sheet, you'll notice that I have gravid and para, but I also have GTPAL. And the reason why is in clinical practice, you tend to see GTPAL. GTPAL is a more detailed version of gravid and para. So the T is for term. Notice that we do not have a separate spot for post-term or post-dates. So in general, once you get past 38 weeks, it always goes in the T. Preterm is 20 to 37 weeks. A stands for abortion. Now, abortion is a broad term. We use that for miscarriage, ectopic, pregnancy loss. So it's not that you had a procedure done, okay? It could be a spontaneous abortion, which is also a miscarriage. It could be an elective abortion. So you want to be really careful when you're talking with patients, because if you see that, oh, I see you've had 4 abortions, the patient may look at you because there's a lot of weight with that word abortion. Like, what? I would never have an abortion. And that can really affect your therapeutic relationship with the patient. And then L is living. Now, the way that I handle living as an OB nurse, I want to know about the number of currently living children. And the reason I want to know that is, let's say that my patient is a gravid 2, para 1. She's in labor and delivery, but that first baby died from SIDS. So it was born alive, okay, but it died at 3 months. If you just told me gravid 2, para 1, and I didn't have any other information, I might go in and say something very uncaring like, oh, is your son excited about being a big brother? I'm like, oops, totally missed that. So some things happen to kids. Sometimes they die from prematurity, SIDS, motor vehicle accidents, all kinds of stuff. The other thing is, so the question is, what if I have adopted children? You know, do I count that in the living? And I think whatever helps you take care of your patient better, you know. But I kind of want to know, well, who's in the household, who's in the family, so I can know how to best kind of help them take care of everybody. All right, so let's look at the first one. So the wording you will see here is very similar to the exam. A woman has her pregnancy confirmed today in the office. So the way that I would do this gravid and para is I would use little hash marks. So gravida, para, gravida, term. Okay. So she has her pregnancy confirmed today. That's a gravida. Obstetrical history includes babies delivered at 34. That's a gravida. That's a para. That's a gravida. 34 is preterm. Everybody with me so far? 38. That's a gravida. That's a para. And that's a term. Ooh, I put these too close together. Right? Okay. And 41, that's a gravida, that's a para, and that's going to count as a gravida and a term behind here. So right now, all of her children are living, and she had a first trimester miscarriage 3 years ago. 5, 3, 5, 2, 1, 1, 3. Double check me here. So let's go back. She's pregnant today. That's a gravida. She has 1, 2, 3, and she had a miscarriage. So that's 5 total pregnancies. So 3 of those went past 20 weeks. 2 were term, 1 was preterm. She had a miscarriage and she has 3 kids. So she's a gravida 5, para 3, and her GTPAL is 52113. Okay? All right. abortion, and living. So the ultrasound today confirms the client has a viable pregnancy at 12 weeks. That's a gravida. The client had an ectopic pregnancy 4 years ago. That's a gravida. That's an abortion. And then she delivered a stillborn baby, which is a gravida, and a para at 24 weeks. Oops. So she has no living children. She has no term. Sorry, I'm having a hard time keeping up with my gravidas. Correct? Does everybody see? So she's a gravida 3 para 1, but that baby was a stillborn. So stillborns count as paras after 20 weeks. Okay? How'd we do?
Just messed up the abortion part.
Okay, okay. So I would put any pregnancy that doesn't get past 20 weeks, I would put here on A. So let's say the patient delivered 15 weeks. That's not 20 weeks. I would not count it as a para, I would count it as an A. Okay. All right. We're gonna change things up, and this is the confusing part, it's the twins. Yes, sir?
So then preterm is anything that's past 20 weeks,
20
that's not to 38, but
Correct.
it doesn't matter regardless if it was born alive.
Correct, correct. Okay? Because the living part will tell you whether those babies are there or not, okay? All right, so now with twins, I want to give you a simple example first before we try to do the one that's here. Now let's say I'm having my first baby, and it's twins, so I'm a gravida 1, 0, 0, 0. But I'm having 2 babies. And so I deliver 2 babies at 28 weeks. So after I deliver, some places will say you're a gravida 1, para 1, gravida 1, para 1, 2. So you're a 10102. Woo, it's like 90210. So I have 1 para, 'cause it's delivery. So it's 1 delivery. I have 1 preterm delivery, not babies, and I have 2 babies. That's one way to count it. Another way to count it that is also correct, I'm a gravida 1, but I'm a para 2, and so if I count here as 2, then I'm gonna count over here as 2. Both of those are correct. You just have to be consistent that your para matches up with what you're counting as term and preterm. So anything that's a para would be under term or preterm, because para is 20 weeks or greater, preterm is 20 to 37 weeks, 6 days, okay? So I would pick, it's like math, pick the way your brain works the best.
Does it matter for the NCLEX though, if it's a question?
So usually in NCLEX, they might have you have a choice. You might see, so I think you could see either version used. So why did we go to this? It's because now we might have one baby deliver vaginally and another baby deliver by C-section, so we wanted to have a means to account for that. So this is more detailed than what this provides us. Some of it's facility policy. So if this just really hurts your brain, don't use it. Just stick with what's up top, okay? But you need to be consistent, so whatever number you're using for para, you're gonna use for term and preterm here, okay? This is hard, all right? All right, so now, let's go ahead, let's try and do the next one. I want you to do the third problem. Try and do it on your own, and then we'll talk through it. somewhere, somehow I've thrown my cap to my driver's license. Maybe I put it in my pocket.
I'll just do it.
5, 2, 1, 2, 3. I got 5, 3. Who's your twins?
I know, but I did it the other way, where I just counted as pregnancy.
Yeah, you do one pregnancy per twin. Oh, can you do it either way? You can do it either way. She said he just wanted to use this one way we do it either.
It's like, but like my.
2, 3. I feel like it's not 40.
Whoever.
I'm sticking to my way. My way works.
Where? They're all fine. Oh, yeah, right.
Okay, cool.
Yeah.
It says that she's in the office for her initial prenatal visit. I'm assuming that she's pregnant because she came for prenatal visit, but didn't say that.
So it's really easy to forget the current pregnancy. That's what All right, so you guys ready for the trip?
First time that Can't wait to see them start this.
So if you add these two numbers together,
You can audition behind you your way, cause.
all right? And then if you add TP, yep, TP, okay? Yes, so your term and your preterm should equal your para. Okay? There's actually a SE question there. This is a very common SE kind of question. Have to look up.
I bet they're gonna ask them.
I bet it's gonna be able
So if you count it as 2 here, they count as 2 here.
Yeah, but for the Vita, it would be the 2 it would be.
I love when Blake gets all.
So,
41 weeks.
all right, you're asking an excellent question. Does a twin count as 1 in the gravida? It counts as 1 in the gravida. Right?
Okay, so
So gravida is always number of pregnancy.
then we counted one of them for her initial visit.
Correct. She's in the office today for her initial prenatal visit. That's her obstetrical history includes healthy twins, a boy at 41 weeks, spontaneous abortions at 8 and 15 weeks.
Okay.
Because there's 2 missing.